Hi, students. I think you must be in the last minute of your revision right now. Let's have a rapid revision for pediatrics, right? So, only main core pediatrics topics will be covered today, and it is a rapid revision. Do not expect me to discuss each and everything in detail. So this is going. I am going to discuss in terms of facts rather than concepts and points. Okay, get ready. Right. The topics that we are going to discuss are vitamins, milestones, malnutrition, inborn errors of metabolism, congenital adrenal hyperplasia, neonatal resuscitation, inborn errors of immunity. These are all the topics we are going to discuss. Okay, right. The first, let me start with vitamins. Which one causes follicular parakeratosis? Which vitamin deficiency causes follicular parakeratosis? It is vitamin A deficiency. Which one causes parafollicular hemorrhages? Vitamin C deficiency. Hemopericardium occurs in which vitamin deficiency? Again, vitamin C deficiency, otherwise scurvy. Painless rosary often due to vitamin D deficiency. Painless rosary often due to vitamin D deficiency, that is rickets. Whereas painful rosary often occurs in vitamin C deficiency, that is scurvy. கிளாஸ்ல இருக்க ஆன்லைன் கிளாஸ்ல அப்புறம் கால் பண்ணு. Deficiency. Which one causes hemolysis in preterm? Which one causes hemolysis in preterm? It is due to vitamin E deficiency. Hemolysis in preterm is due to vitamin E deficiency because vitamin E is an antioxidant and it protects your RBC membrane. So when vitamin E is not there, free oxidant free radicals will cause damage to the RBC membrane leading on to hemolysis. Right. Circumcorneal vascularization occurs in which one? Riboflavin deficiency. Riboflavin deficiency. Circumcorneal vascularization. Again, which vitamin deficiency called ataxia? Again, vitamin E. E deficiency causes ataxia. Unknown cases, unknown ataxia with unknown causes should be evaluated for vitamin E deficiency, which can be due to malabsorption that can occur as a result of pancreatic insufficiency also. Gum bleeding again most common in which one? Gum bleeding most common in scurvy. That is vitamin C deficiency. Gum bleeding. Ping pong skull, soft skull due to rickets. Vitamin D deficiency. Neonatal bleeding. Neonatal bleeding again it is due to vitamin K deficiency. Is due to vitamin K deficiency. What is called PUCA? PUCA means protein induced in vitamin K deficiency. That is called as PUCA. That is otherwise known as non-gamma carboxylated products of 2,7,9,10. Non-gamma carboxylated products of 2,7,9,10. Right. In which one you will get lower limb rickets? Rickets usually affect both upper and lower limb. When it predominantly involves your lower limb, it is X-linked hypophosphatemic rickets. It is X-linked hypophosphatemic rickets. Hypophosphatemic rickets. Which one? Lower limb, predominantly lower limb. Upper limb will also be involved, but predominantly lower limb. Right. Which vitamin deficiency causes infantile tremor syndrome? B12 deficiency causes infantile tremor syndrome. Infantile aphonia again occurs in B12 deficiency. RBC transketolase, which is the marker of which vitamin deficiency? Marker of thiamine deficiency. Marker of thiamine deficiency. Marker of thiamine deficiency. Whereas RBC glutathione reductase is a marker of which one? Riboflavin deficiency. Deficiency. Angular cheilitis, again riboflavin deficiency. Which one causes developmental delay with alopecia? Very, very important. This question is very, very important. This one causes developmental delay with alopecia. One second. One second. ஏங்க நாளைக்கு நார்மல் டைம் வந்துருங்க 7:30. ஆமாங்க. ஓகேங்க. So developmental delay with the alopecia is caused by biotin deficiency. This is very, very important. Often asked question. Biotin deficiency is usually leads to developmental delay with alopecia and dermatitis, and it depends on what enzyme? Multiple carboxylase enzyme. Multiple carboxylase enzyme. Very important, this one. Avidin. Which vitamin is related to avidin? Avidin is present in the egg, which disrupts biotin absorption. Which disrupts biotin absorption. That's why you need to boil the egg and eat, so that avidin will be destroyed. Your biotin will be freely available for absorption. Which vitamin deficiency is associated with the maize eating population? It is pellagra. Aldar niacin deficiency mainly occurs in maize eating population, because maize contains bound tryptophan which cannot be released. Bound tryptophan which cannot be released. Tryptophan which cannot be released. Neuroregression. Enzyme deficiency which is associated with the neuroregression. Two things. One is biotin. Another is B12 deficiency. Both of them are associated with the neuroregression. Vitamin deficiency associated with pancytopenia. Again B12 deficiency. Not only macrocytic anemia, but also because of poor DNA maturation, it is associated with pancytopenia. Urine methylmalonic aciduria is the investigation of choice for. Urine methylmalonic aciduria is investigation of choice for B12 deficiency. Do not write chilling test. Chilling test is obsolete right now, because B12 converts methylmalonyl CoA. Methylmalonyl CoA is converted into succinyl CoA. When B12 is not present, methylmalonic acid is increased in urine. So methylmalonic aciduria is the screening test for choice in B12 deficiency. Hypersegmented neutrophils. It is present in both B12 or folate deficiency. Occurs in both B12 and folate deficiency. B12 and folate. Define hypersegmented neutrophils when 5% of neutrophils contain more than 5 plus or minus 4 lobes. I repeat, 5% of neutrophils contain 5 lobes. or even one neutrophil contains 6 lobes. One neutrophil contains 6 lobes of neutrophil. This is the proper definition for hypersegmented neutrophil. I repeat, when 5% of neutrophils contain 5 lobes, whereas even when one neutrophil contains 6 lobes, it is called hypersegment. Which one you will get? Diarrhea, dermatitis and dementia. Diarrhea, dermatitis and dementia, again you all know pellagra. Niacin deficiency. Homocystinuria is associated with which vitamin deficiency? It is pyridoxine. It is used in pyridoxine. Again, peripheral neuropathy is associated with which vitamin deficiency? Again, the answer is pyridoxine. Pyridoxine. Both of them are associated disease. Right. Refractory seizures in newborn or intrauterine seizures in newborn. Which vitamin deficiency? Again, pyridoxine. Pyridoxine is associated with intrauterine seizures or refractory seizures at newborn in the absence of birth asphyxia. Burning feet syndrome, pantothenic acid, which is pantothenic acid. Burning foot syndrome. Wimberger sign. You all know that is otherwise known as ringed epiphysis. Otherwise known as ringed epiphysis occurs in scurvy. Trummerfeld zone. What is Trummerfeld zone? A zone of rarefactions in the metaphysis. Again, Trummerfeld zone is a zone of rarefaction in the metaphysis, occurs in scurvy. And this one is often asked question. Tetany not responding to calcium. What will you think in terms of? Tetany not responding to calcium. What you will think of? When tetany is not responding to calcium in the presence of hypocalcemia, always rule out magnesium deficiency. Rule out magnesium deficiency. This is often asked question. Magnesium deficiency. Tetany not responding to calcium. Hypogonadism, poor wound healing, periorifacial dermatitis, all occurs in zinc deficiency, or otherwise known as acrodermatitis enteropathica. Acrodermatitis enteropathica. Neutropenia with IRIDA. What is called resistant iron deficiency anemia? If you have a microcytic hypochromic anemia, it is presumed that it is due to iron deficiency anemia. When you give iron, cytosis should disappear, hypochromia should disappear. If it doesn't disappear, that is called IRIDA. IRIDA means iron resistant iron deficiency anemia. And one cause for IRIDA along with neutropenia is copper deficiency. Cardiomyopathy is associated with selenium deficiency. Cardiomyopathy is associated with selenium deficiency. Right. So vitamins over almost how many? 1, 2, 3, 4, 5, around 20 to 20, more than 30 points are for vitamin deficiency. Definitely you will be getting one question from that. Again, nutrition, a part and parcel of your general pediatrics. Flaky paint dermatosis, as if the skin is peeled from the skin. Some areas of skin are peeled from the body. So flaky paint dermatosis occurs in kwashiorkor. Flaxane, again alternated pigmented and depigmented skin, occurs in kwashiorkor. Baggy pant appearance. What is baggy pant appearance? Loss of subcutaneous fat. Online class la irukku. ஆனா 1 hour 1 hour 1 hour ஆகும். So flaky paint dermatosis, plaque sign, both of them occurs in kwashiorkor. Flaky paint appearance, marasmus, that is due to loss of subcutaneous fat. Monkey faces, marasmus, due to loss of subcutaneous fat in the faces. Energy deficiency leads to marasmus, whereas protein deficiency leads to kwashiorkor. Kwashiorkor. What is mid upper arm circumference? Mid upper arm circumference is the midway between tip of acromion to tip of olecranon. Tip of olecranon. And if it is less than 11.5 centimeter, it is termed as severe acute malnutrition. Mid upper arm circumference less than 11.5 centimeter is called as severe acute malnutrition, and you will measure with the help of a tape called Shakir's tape. Mid upper arm circumference is the same between 6 months to 5 years. It won't alter with age. That's why a value of less than 11.5 centimeter is invariably called as a manifestation of severe acute malnutrition. So what is the tape it was mentioned? It was called Shakir's tape. Shakir's tape, that colorful tape. If you get red color means less than 11.5 centimeter. If you get yellow color means it is 11.5 to 12.5 centimeter. If it is green means it should be more than 12.5 centimeter. That is the utility of Shakir's tape. Remember, weight for height, and recently asked question in our latest initiatives. When weight for height reduced means what does it mean? It is a manifestation of acute malnutrition. This question was asked. When weight for height is reduced means acute malnutrition. When height for age reduced means chronic malnutrition. Chronic malnutrition. Whereas when weight for age reduced means it is acute on chronic malnutrition. Acute on chronic malnutrition. Malnutrition. What is called risomol? Risomol is nothing but rehydration solution for malnutrition. Solution for malnutrition, that is called risomol. The osmolality of risomol is 300 milliosmol per kilogram. 300 milliosmol per kilogram. Which is mainly used in treating children with severe acute malnutrition. One more question they can ask you: how do you prepare risomol? Risomol can be prepared by adding 2 liter of water with one ORS packet along with 45 millimole of pot chlor, potassium chloride, along with 50 milligram of sugar, 50 grams of sugar. This is how do you prepare. This is how you prepare 45 plus 40 grams of sugar. This is how you prepare your risomol. What is WHO ORS? WHO ORS is the ORS that we are using right now. The osmolality of WHO ORS is 245 milliosmol per kilogram. 245 milliosmol per kilogram. The old ORS 311 is not at all used nowadays, because the old ORS is mainly used for cholera diarrhea, but majority of diarrhea which occurs right now is due to post-viral diarrheas, the viral diarrheas, in which the amount of osmolality lost in stool is less. Right? Right. Why this is okay. Acute on malnutrition, vitamins over. Now comes congenital adrenal hyperplasia. A very, 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 very important question. Look at this. This is called ambiguous genitalia, or otherwise known as atypical genitalia. Now, the previous terms such as pseudohermaphrodite should not be used. Ambiguous genitalia should not be used. It is called atypical genitalia, the most common presentation of congenital adrenal hyperplasia. You all know that adrenal steroid biosynthetic pathway occurs, and there are so many enzymes. In any one of these enzymes, if there is a deficiency, it will manifest as atypical genitalia, hypotension, hypertension, etc. Definitely, one question will be asked from congenital adrenal hyperplasia. Right. So when we fill this tabular column, it will be more than enough for you to pick up your choices in your entrance examination. Right. The most common is 21 alpha hydroxylase deficiency. Boys usually get precocious puberty. Boys usually get precocious puberty. In girls, it leads to atypical genitalia, or otherwise known as ambiguous genitalia. Blood pressure in 21 alpha hydroxylase is low. Often it presents with shock. What will happen to electrolytes? Sodium will be low, water will be low, whereas potassium will be high, H plus will be high. Most often question asked with respect to CAH is 21 alpha hydroxylase enzyme deficiency. Okay, the second one is 11 beta. Let's go to 11 beta. In 11 beta also you will get precocious puberty in boys and atypical genitalia in girls. Genitalia in girls, but here instead of low blood pressure you will get high blood pressure, high BP. Because of 11-deoxycortisol, which functions as your aldosterone. So what will happen here? Sodium will be high, water will be high, whereas potassium will be low, H plus will be low. Right. Then 17 alpha hydroxylase and 1720 lyase. 17 alpha hydroxylase and 1720 lyase induced by atypical genitalia. Boys, and in boys it is characterized by atypical genitalia because this pathway is useful for the production of testosterone. So boys and girls are both characterized by atypical genitalia. Boys in both 17 alpha hydroxylase and 20 in and 1720 lyase, whereas girls the genitalia is normal. So what will happen to BP? Again here high BP. 17 alpha, here it is associated with high BP. So what will, because there is excess aldosterone production. Remember, when 21 alpha hydroxylase is affected, your aldosterone pathway will be affected, then it will be associated with hypotension. Here that pathway is not affected. High BP. High BP means what? Sodium will be high, water will be high, whereas potassium will be low, H plus will be low. H plus will be low, right? So, and then 3 beta HSD, right? So, what is the role of 3 beta HSD? Again, 3 beta HSD is the one which converts androstenedione into stenedione. When 3 beta HSD is not there, androstenedione will be formed and it is a weak androgen. And 3 beta HSD is also useful for the production of aldosterone. So, what will happen? In 3 beta HSD, boys will have hypospadiasis. Boys will have, this is very, very important, boys will have hypospadiasis. Boys will have hypospadiasis because it is a weak androgen. Which one? Androstenedione. Girls will have mild hirsutism. Again, because of excess weak androgen. In boys, that weak androgen will have the ability to pull the urethral tip into the glands. That's why you will get hypospadiasis. In girls, this amount of weak androgen produces hirsutism. acne, everything, not to the extent of causing complete virilization of the external genitalia. And both of them will be associated with low BP. Low BP means sodium will be low, hydra water will be low, whereas potassium will be high and H plus will be high. H plus will be high. And finally, what is star protein? Star protein is the one which helps in the transport of cholesterol into mitochondria so that all other process will occur. So what will happen? All in boys it will leads to atypical genitalia because the process itself will not be started, and you all know that sex is the usually it is the default process of female sex is the default process of sexual differentiation. When there is no testosterone, when there is no SRY, it invariably leads to female genitalia. Since star protein is the initial pathway, initial enzyme in the pathway, your male hormones will not produce, so that atypical genitalia in so that atypical once again atypical genitalia in which one? Boys. In females, normal genitalia. In female normal genitalia, PP will definitely be low. Okay, PP will definitely be low. So this tabular column just before exam is definitely going to help you in so many ways. And the treatment offered in congenital adrenal hyperplasia, apart from that, what are all the 3 points that you need to know? So remember, in 21 alpha hydroxylase, in star protein deficiency, whereas in 3 beta HST, in that you will have hypotension. So what is the management? Lifelong you need to give hydrocortisone. You need to give hydrocortisone as well as hydrocortisone and fludrocortisone, these enzymes. Whereas in case of 17 alpha hydroxylase, 1720 lyase, 11 beta hydroxylase deficiency, in these deficiency, invariably you will get hypertension. So you need to give only hydrocortisone. Fludrocortisone not necessary. Fludrocortisone is not at all necessary. So what is the investigation of choice for congenital adrenal hyperplasia? Very, very important. The investigation of choice for congenital adrenal hyperplasia is 17 hydroxyprogesterone. That is the investigation of choice. 17 hydroxyprogesterone. Definitely this one chart is going to fetch you at least one question correct. Congenital adrenal hyperplasia. Right. So investigation of choice is 17 hydroxyprogesterone. In these first three enzyme deficiency, you need to give hydrocortisone and fludrocortisone. In the next 17 alpha hydroxylase, 1720 lyase and 11 beta hydroxylase, only you will, since you get hypertension, you need to give only hydrocortisone but not fludrocortisone. Fludrocortisone is not necessary. This is about congenital adrenal hyperplasia. Right. Newborn, what are all the questions they will ask you? Okay, in newborn, what are all the questions they will ask you? So with respect to neonatal resuscitation, what do you mean by delayed cord clamping? Delayed cord clamping means you need to cut the cord 30 seconds to 1 minute. 1 minute after birth. 1 minute after birth. That is delayed cord clamping. First MCQ. Second one, what is called sniffing position? Sniffing position is nothing but you are keeping a roll of towel under shoulder blade. That is called sniffing position. Sniffing position, that means what? Your nasopharynx, your oropharynx and trachea will be in the straight line. What are all the 3 points for resuscitation? What are all the 3 things that you need to consider for resuscitation? The three things that you need to consider for resuscitation: one is cry, second one is tone, third one is respiration. I am sorry. Third one is term or preterm. Third one is term or preterm. So cry, tone, term or preterm are the 3 points that should be considered. You will not consider color and you will not consider Apgar for starting neonatal resuscitation. Right? What is the indication for PPV? Indication for PPV is heart rate less than 100 per minute. Is the indication for PPV. Heart rate less than 100 per minute. Labored breathing. Labored breathing. Okay, and then persistent cyanosis. Persistent cyanosis. These three are the causes for positive pressure ventilation. Okay, what is the indication for CPAP? Again, indication of CPAP is heart rate should be more than 100 per minute. And then persistent tachypnea. As well as persistent cyanosis. But heart rate should be more than cyanosis, but heart rate should be more than 100 per minute. Cardiac massage. What is the indication for cardiac massage? Heart rate less than 60 per minute is the indication for cardiac massage. Heart rate less than 60 per minute is an indication for cardiac massage. Heart rate less than 100 per minute is the indication for bag and mask ventilation or positive pressure ventilation. Okay, for cardiac massage, there are two techniques, two thumb technique and two finger technique. Only two thumb technique is recommended right now. No role for two finger technique. Role for two finger technique. What is the CPR ratio? CPR ratio is 3 cardiac massages plus 1. 3 cardiac massage and 1 ventilation. 3 cardiac massage and 1 ventilation. So there are totally 120 events per minute. 120 events per minute. 90 chest compression and 30 ventilation in 1. Chest compression and 30 ventilation in 1:1. What is the contraindication for PPV? The only contraindication is congenital diaphragmatic hernia. Why? Because whenever you give positive pressure ventilation, invariably you will be trying to push some amount of air into the intestinal support that we give. So the contraindication for PPV is congenital diaphragmatic hernia. What massage is fail? So despite 1 minute of successful cardiac massage with the 90 ventilation, 90 chest compression and 30 ventilation in 1:1 ratio, you need to go for injection. A best route is what? Umbilical vein. The best route is umbilical vein, and peripheral veins also can be used. But peripheral veins can also be used. But if it is not possible, then you can use intraosseous route. That is, you know how to do a bone marrow. In the same way, you use a bone marrow needle and you need to just insert the needle just above the level of the tibial condyle. That is intraosseous route. Okay, right. So umbilical vein, intraosseous route, injection adrenal. Remember, the injection adrenaline available is 1 in 1000. That has to be, so 1 ml contains. That has to be mixed with 9 ml of normal saline to convert into 1 in 10,000 adrenaline. This 1 in 10,000 adrenaline should be given 0.1 ml per kg to 0.3 ml per kg of adrenaline. The dosage of adrenaline. Okay, right. What will you do in failed intubation? Invariably, you need to intubate the child before proceeding for cardiac massage. When you can't intubate, what you will do? What you will do? Simple. You need to use laryngeal mask airway so that you can take LMA and just you can take laryngeal mask airway and it blindly you will go into the oral cavity so that it will go and snugly fit into the laryngeal inlet. That is called laryngeal mask airway. Right. What is role of oral? There is no role of oral in neonatal resuscitation. Only we can give normal saline 10 ml per kg. If not, O negative blood. If not, O negative blood. Right. RL is not utilized now. Only normal saline and O negative blood. Role of tracheal meconium aspiration. Previously, in meconium aspiration child, you need to intubate and take the meconium from the trachea during the suction with the help of a suction apparatus. It is not recommended now. Not recommended. Which one? Tracheal suction. Is there any role of antepartum suction, that is after the delivery of the head but before the delivery of the shoulder? No, it is not recommended. What do you mean by 6 hours, 24 hours and 3 months? Anyone? 6 hours, 24 hours and 3 months. What does it mean? So your expressed breast milk is stable in a room temperature for 6 hours, and your expressed breast milk is stable in fridge middle and lower rack for about 24 hours, whereas this expressed breast milk when kept in freezer is stable for about 3 months. Is stable for about 3 months. Stable for about 3 months. Expressed breast milk. 6 hours room temperature, 24 hours middle and lower rack, and 3 months freezer. Okay, some neonatal conditions. Pink diapers are mainly due to urate crystals. Normal. Eosinophil laden sterile skin lesion are called as erythema toxicum. Again, benign. Keratin filled cyst in the palate is for keratin. What is that? Epstein pearls. That is called Epstein pearls. What is that white papular lesion in face and nose in newborn? These are all the normal neonatal skin condition. It is called milia. Again, benign condition. Milia is a benign condition. What do you mean by small for gestational age? Small for gestational age means less than 10% weight for gestational age. This is a statistical definition. Whereas IUGR is a morphological definition. Weight less than 1000 grams is called extremely low birth weight. extremely low birth weight. Okay. What do you mean by cold injury? You all know that what is the normal newborn temperature? Normal newborn temperature is 36.5 to 37.5 degree Celsius. Normal newborn temperature. So 36 to 36.5 is cold injury, whereas 32 to 36 is moderate hypothermia. Less than 32 degrees Celsius is severe hypothermia. Severe hypothermia. So this is severe, this is moderate, this is mild, this is normal. So cold injury is 36 to 36.5 degree Celsius. Hyperthermia means more than 37.5 degree Celsius. Hyperthermia means more than 37.5 degrees Celsius. This will often be asked. The most often question is cold injury or cold stress. It is the temperature between 36 to 36.5 degree Celsius. That is important, cold injury. Okay. So feeding of preterms less than 28 weeks. Intestine will not be mature, so that you will give IV fluids. Whereas between 28 weeks to 32 weeks, intestine will be mature, but there is no sucking swallowing coordination. So nasogastric feed. Gokernam or Paladi feeding is between 32 to 34 weeks. Whereas direct breastfeed can be started from 34 weeks, in which sucking swallowing coordination will occur. Sucking swallowing coordination will occur. Feeding of preterm. Right. So what other newborn topics that can be asked? What are all the two scores for respiratory distress syndrome? Two scores for respiratory distress syndrome. One is Downey score. Another is Silverman Anderson score. Another is Silverman Anderson score. Okay. Now there are some clinical vignettes I have told you. When you have a term child, were born of LSCS, and the child had a mild respiratory distress syndrome, relieved on day one. So what is the diagnosis? The diagnosis is transient tachypnea of new. The diagnosis is transient tachypnea of newborn. What will you do? A preterm, the next question. The preterm Downey score 5. What will you do? Preterm Downey score 5. What will you do? The first one is you need to give CPAP. Please remember, the treatment of choice for all respiratory distress syndrome initially is not surfactant administration, even though it is due to surfactant deficiency. The treatment of choice is continuous positive airway pressure. Okay, positive pressure. If it doesn't work, then you give CPAP along with Ensure. Ensure was asked recently in INICET. What is called Ensure? Yeah. What is called Ensure? Intubate. What is called Ensure? Intubate, surfactant administration, and extubate. Intubate, surfactant administration, and extubate. That is called Ensure. Remember, the first investigation of choice is CPAP. If it doesn't work, CPAP plus Ensure. If it doesn't work, and your which one? Second. Low charge. And if it doesn't work, then you need to go for surfactant plus mechanical ventilation. Surfactant plus mechanical ventilation. This Ensure was asked in the recently concluded May Aims. Sorry, INSET. Define severe perinatal asphyxia. So at 1 minute, if your Apgar is between 0 to 3, at 1 minute, if your Apgar is 0 to 3, it is called severe perinatal asphyxia. Neonatal hypoglycemia means blood glucose of less than 45 milligram per deciliter. What is called neonatal hypocalcemia? Term means less than 8 milligram per deciliter, whereas preterm means it is less than 7. Whereas in case of a millimole means term 4.8, preterm less than 4 in terms of millimole per liter. Millimole per. So these are all the some of the famous statements that can be potentially be asked in our entrance. Now, let's cover all the things we had completed. Vitamins, little bit of points, congenital adrenal hyperplasia, severe acute malnutrition, some neonatal conditions, skin conditions, respiratory distress syndrome, etc. Now let's go to important thing, that is milestones. So what is this? Chin momentarily in midline. So for momentarily in midline usually occurs by 4 weeks. Momentarily in, so chin up 45-degree. Okay, whereas the child's bare weight on forearm with chin and shoulder at the level of the ground is, this is very very important. This is 8 weeks. This occurs at 8 weeks. 45-degree chin up occurs. Look at this. The child lifts the head and greater part of the chest while supporting weight on flexed forearms. Flexed forearm means 3 months. Extended forearm means 6 months. Both of them a potential MC. Flexed forearm means 3 months and the extended forearm means 8 months. 8 months. 8 months. What is this? What do you mean by crawling? What do you mean by creeping? Crawling means abdomen on the ground. Usually occurs by 8 months. Whereas creeping means abdomen off the ground. Abdomen off the ground. That means 10 months. And the third one is beer walking. Third one is beer walking. That occurs by 12 months. Beer walking occurs by about 12 months. Crawling, abdomen on the ground. Creeping, abdomen off the ground. Crawling 8 months, creeping 10 months, and beer walking 12 months. What is really sitting with support? Tripod means it usually occurs but at 6 months. Sitting without support usually occurs but by about 8 months. What is pivot? Turning diagonally back towards source of sound occurs by about 11 months. Pivot 9 to 11 months. Pivot 9 to 11 months. Pivot. Okay. What is this? The child bears entire weight when made to stand. This occurs by 6 months. Cruising around the chair, again 10 to 11 months. Cruising around the chair, 10 to 11 months. Stands without any support, 12 months. Walks independently, 15 months. Walks independently, 15 months. Okay, now look at this. Walk backwards. Walk backwards, 18 months. Climbs up using both feet per step usually occurs by 2 years. Jumping usually occurs by 2 years. Occurs by 2 years. So this is rapid revision, boss. Okay. And then climb upstairs with 1 foot per step. It means climb 1 foot per step means 3 years. Up means 3 years. So 1 foot First step. Climbing up means 3 years. Climbing down means 4 years. Right tricycle 3 years. Right side tricycle 3 years. Tricycle 3 years. Right. So what is this? Able to hold the toy by this is bidextrous grasp. Dextrous, unidextrous grasp. Bidextrous grasp using both legs. Unidextrous grasp 6 months. Transfer of objects occurs by about 6 months. By about 6 months. Right. Everything into mouth. Mouthing usually lasts between 6 months to 1 year. After that, they won't put everything into mouth. They will put mouth certain things, selective things into mouth. Whereas between 6 months to 1 year, they will put everything into mouth. So what is this? The child starts scribbling. Okay. Scribbling usually occurs by about 18 months. Sibling usually occurs. Okay. By about 18 months. By about 18 months. Okay. Then what is this? Put shoes. Put shoes. Look at this. What are all the other things that the child is doing? Trying to put shoes and socks. Okay. Shoes, shoelaces. Shoelaces by about 5 years. Okay. Putting socks by about 15 to 18 months. 18 months. Okay. So shoelaces by about 5 years. Socks, putting socks by about 15 to 18 months. 15 to 18 months. Okay, 15 to 18 months. And then with respect to, okay, with respect to play with boxes or squares. So two box by about 15 months. Okay, three box by about two box by about 15 months, three box by about 18 months. By about 2 years, six boxes. By about 3 years, nine boxes. Okay, these are all the things they used to play with it. Okay, by about 3 years, they can build up a gate by about 5 years, steps by about 6 years. Okay, by about 6 years. So these are all the small things that they can ask you with respect to milestones. Respect to milestones. Now, IMNCI protocol. You all know that pink means you will refer, yellow means you will treat, green means you will observe. Definitely there will be one question with respect to IMNCA. Okay, a respiratory rate of more than 60 per minute, less than 7 days. People used to say less than 2 months means you need to observe, but as per new IMNCA adaptation 2022, respiratory rate more than 60 per minute, less than 7 days, you admit. That is, think you need to refer after giving a course of AMPI and Genta. After giving first dose AMPI and Genta. Whereas respiratory rate of 60 per minute, age 70 to 59 days. 70 to 59 days means you can give a course. That is what IMN says. Amoxicillin. So this comes under yellow zone. Yellow zone. Jaundice in palms and soles means it is severe. Severe. You need to refer. You need to refer. Skin pinch goes means severe dehydration. Pink. You need to refer. Weight of less than dash severe. Less than 1800 grams means severe malnutrition. Pink category, you need to refer. You need to refer. Right. So these are all the tidbits that were asked previously in your insert and NEET exam. Severe pneumonia, what are called as dysentery. Rice water is stools means it is usually cholera. What is the drug of choice? Drug of choice for cholera is single dose doxy. Single dose doxy as per IMNCI. Doxy 2.2 mg per kg that if the child is more than 2 years. If the child is more than 2 years. Child is more than 2 years. Right. Then fever in IMNCA. What are all the points fever with IMNCA? When you have fever plus the neck stiffness, as per IMNCA, it can be either due to meningitis or it can be due to cerebral malaria. So meningitis as per IMNCA, AMPI plus gentamicin. Malaria means you need to give IV quinine or RT-28. Again, as per IMNCA guidelines. Fever with abdominal pain, positive tunic test and cold peripheries. Recently, in the recent 2022 adaptation of IMNCA guidelines, they had included dengue. Any child with fever and abdominal pain. Any child with fever and abdominal pain should be investigated for dengue as per new IMNCI guidelines. Dengue. So dengue is recently included. Dengue is recently included in IMNCI guidelines. Recently been included. Right. Then comes fever with clouding of cornea. Fever with mouth ulcers is usually due to measles. Give vitamin A. So more than 2 lakh single unit. For 6 months to 1 year means 1 lakh 50,000 international units of vitamin A. And remember, vitamin A reduces overall mortality, not just to prevent blindness. Eye discharge in IMNCI less than 14 days means it is Streptococcus pneumoniae. Oral amoxicillin is the drug of choice. More than 1 second. Intradermal IPV. So these vaccines are given at 6 and 14 weeks. Whereas at 10 weeks, you will give OPV. There is no PCV. You will give second. Okay. Capital T, small t. Right. Right. What are all the vaccine that you will give in? Yes. What are all the vaccines that you keep in freezer? The vaccine that you keep in freezer are the only one vaccine that will be kept in freezer, that is OPV. In first track, you will keep MMR and BCG. Middle rack, all vaccines. Middle rack, all vaccines starts with the T. That is typhoid, tetanus, Tdap, TD, everything. Lower rack is for varicella. This is how you keep your vaccine in the refrigerator. Varicella, hepatitis B, and diluents. Diluents. Shake test. Shake test is mainly for vaccines that should not be kept in freezer. That should not be kept in freezer. So when you keep those T vaccines in the refrigerator, it will lose its potential. Okay, it will lose its potential. So that how do you know that you have accidentally kept in refrigerator? Simple. Take the vaccine, just shake it up and look for sediment. Present of sedimentation means you had accidentally kept the vaccine in the freezer. Okay, so what are all the, so this is very very important. The only vaccine that is kept in freezer is OPV. First track is MMR and BCG. A middle rack contain all vaccines with the starts with the T. Lower rack means varicella, hepatitis B, diluent. Check test is mainly meant for vaccine that should be kept in freezer. That should be kept in freezer. Okay, that should be kept in freezer. Right. So what are all the live vaccine and what are all the live vaccines, you know? The live vaccines are one is varicella is a live vaccine, BCG is a live vaccine. Then what else? Varicella, BCG, hepatitis A is a live vaccine, Rota is a live vaccine. These are all the live vaccines. Varicella, BCG, hepatitis B, MMR is a live vaccine, JE is a live vaccine. JE is a live vaccine, right? So what are all the killed vaccine? All other vaccines are killed, particularly your DPT, your pentavalent vaccines are killed. Valent vaccines are killed vaccine. Normal saline is a diluent for two vaccines. One is BCG, another is yellow fever. For all other vaccines, you need to use distilled water, sterile water as a diluent. Sterile water as a diluent. Right. Splenectomy with respect to vaccination. Give your Haemophilus influenza, you need to give meningococci, you need to give pneumococci. So 2 weeks before splenectomy. 2 weeks before splenectomy. Steroids. When you give when you give 2 milligram per kilogram, 2 milligram for more than 2 weeks, you are not supposed to give vaccine. No live vaccine for 4 weeks. This is very, very important. This is the rule of 2 2s are 4. When you give 2 mg per kg for more than 2 weeks, no live vaccine for 4 weeks. HIV, if CD4 count more than 15, all vaccines can be given. Live vaccines can be given except BCG yellow fever. These vaccines should not be given. Or else if CD4 is more than 15%, all vaccines can be given. Following chemo preterm, only postpone which vaccine? Hepatitis B. BCG can be given, OPV can be given. Following chemotherapy, no vaccines for 6 months. Following chemotherapy, no vaccines for 6 months. Following blood products, no vaccines for 12 weeks. No vaccines for 12 weeks following blood products. So this is very, 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 very important slide. Right. Okay. Then inborn errors of immunity, one liner. Recurrent abscess is a manifestation of phagocyte disorder, that is neutrophilic disorder. The neutrophilic disorder that is associated with the catalase positive organism is chronic granulomatous disease. Granulomatous disease. Very, very important. Chronic granulomatous disease. Recurrent pneumonia more than 6 months is Bruton's. A gamma globulinemia. Right. A gamma X-linked recurrent A gamma globulin. When you have pneumocystis carinii CMV pneumonia, it is T cell disorder. T cell disorder. When you have PCP pneumonia alone, along with other deficiency, it can occur in hyper IgM syndrome. Eczema with thrombocytopenia, you all know Wiskott-Aldrich syndrome. Eczema with eosinophilia and painless abscess is hyper IgM. I'm sorry, there are the OBS and the connectivity. I'm extremely sorry. Okay, giant granules with is digoxin. Giant granules. Right, giant granules in neutrophil is a manifestation of Chidiac-Higashi syndrome. Chidiac-Higashi. Pompe's disease is due to acid maltase. Cory's disease is due to debranching enzyme deficiency. Anderson disease is due to branching enzyme deficiency. McArdle's disease. McArdle's disease is due to myophosphorylase. Torres is disease due to phosphofructokinase. Deficiency. Remember, this is presents with hypoglycemia. Which one? Von Gierke. Debranching enzyme, hypoglycemia. Branching enzyme, hypoglycemia. Acid maltase pompis is due to floppy infant with massive cardiomegaly plus large heart. McCardle's disease and McCardle's disease and Torres disease mainly manifest with exercise-induced muscle weakness. With exercise-induced muscle cramps. 517. Okay, glycogen storage disorder. Now lysosomal storage disorder. Kocher's disease is due to deficiency of glucocerebrosidase, in which you have type 1. Type 1 mainly manifests with non-neuropathic type. They manifest only with hepatosplenomegaly. Type 2, fast neuroregression. Fast neuroregression. Type 3, slow neuroregression. Niemann-Pick's disease, you all know A, B, C. A and B are due to sphingomyelinase deficiency. Whereas C is mainly due to defect in cholesterol export. Defect in cholesterol export. That's why what happens, cholesterol will be accumulated in all cells of the body. Diffuse cholesterol accumulation, cholesterol export. Sandoff. Sandoff disease is mainly due to hexosaminidase. GM1 gangliosidosis is mainly due to what? GM1 gangliosidosis. Okay, is mainly due to what? Is mainly due to what? Beta galactosidase. Enzyme beta galactosidase enzyme deficiency. Tay-Sachs again hexosaminidase. Aminidase enzyme deficiency. Right? Metachromatic leukodystrophy, aryl sulfatase deficiency. Okay, Krebs disease is due to galactocerebrosidase. Galactocerebrosidase. Fabry's disease is due to, okay, Fabry's disease is due to alpha galactosidase. Deficiency. Farber's disease is due to ceramidase deficiency. It is deficient. Ceramidase deficient. Definitely, I think you will be getting one question from this ceramidase deficiency. What is this? Acute IEM. The investigation of choice is tandem mass spectroscopy. Okay, right. When you have acidosis, what is the approach to acute IM? Often asked question. When you have acidosis, ketosis, and hyperammonemia, it is called organic aciduria. When you have acidosis, hyperammonemia, but no ketosis, is fatty acid oxidation disorder. When you don't ketosis, only hyperammonemia, means urea cycle disorder. Alopecia plus dermatitis. Alopecia with dermatitis is a manifestation of biotin or multiple carboxylase deficiency. Abnormal urine order can be due to glutaric aciduria or isovaleric acidemia. Whereas when you don't have skin manifestation, don't have abnormal urine, then it is due to what? Then it is due to no skin manifestation, no abnormal urine order, means it can be propionic acidemia, or it can be due to methylmalonic acidemia. Okay, methylmalonic acidemia. Right? Finally, phenylketonuria is mainly due to what? Phenylketonuria. tyrosine hydroxylase. Treatment is tetrahydrobiopterin cofactor. Also protein restricted diet. Tyrosinemia. There are so many tyrosinemias. Okay, the main type 1 tyrosinemia often manifest. It can be treated with nitisinone. Tyrosinemia can be nitisinone, and the investigation of choice is urine succinyl acetone. Very, very important. Urine succinyl acetone. Urine succinyl acetone. Maple syrup urine disease. Alpha keto acid dehydrogenase deficiency. Yes, deficiency. It can be treated by giving thiamine. Very important. Often asked question. Can be treated by giving thiamine. Homogentisic acid oxidase deficiency. Alkaptonuria again can be treated with nitisinone. Nitisinone as well as vitamin. I think a rapid revision regarding general pediatrics